So many times we'll have people come in with back pain, hip pain, etc. It's a pelvic pain, and it'll be in the front of their leg, and so or in the front, it'll be right around where the belt and the right above the pocket of the pant where the belt may hit them on the hip on that what's called the ASIS, anterior superior iliac spine. But ultimately, it's just the front. It's kind of where the muscles attach when you're flexing your leg. So if you have this could be hip flexor pain. Okay, hip flexors are notoriously tight on athletes, people that sit for long periods of time, etc. That is one of the biggest things that I always check for anybody with low back pain, hip pain, is the hip flexors. So if you do have pain in that area, a couple things that you can do is foam roll it. You can just get on a foam roller and grind that out a little bit, elongate that tissue, because again, it may just be tight and the attachment site is inflamed. And so if you can get that to open up and relieve a little pressure on that attachment site, that may take care of the problem. Secondly, what you can do is stretch. So things like the couch stretch is basically where you get into a lunge and you pull your leg up and put your foot, you're in a lunge position on the floor, and you put your foot up on something, on a wall or a couch, and that can be extremely beneficial to help to open it up. And you'll see in some of our other videos how you can, if you activate your glute, it'll fire into that hip flexor a little more. So check out some of our other videos on that, on wherever. But that will help you open up that anterior hip, which will stretch the hip flexor, which will ultimately reduce that pain, if not completely resolve it. And also, too, hip flexors and having mobile hip flexors are vital to having a healthy low back, having a healthy, basically entire lower half. So it should be a part of every person's daily routine, is opening up their hip flexors, because if it's not and you're very tight, or if you see a lot in soccer players, because they're doing a lot of striking, a lot of hip flexion and power, they become very, very powerful in that hip flexion motion, and so it can get very inflamed and they can get a lot of pain. So also, too, one thing, just as a side note, what can happen as well is the pelvis can rotate. And so many times what you'll see as on an anterior pelvis because many times when a pelvis rotates, one side will go forward, the other won't come back. Many times that forward pelvis, or that forward part of the side, is the side of inflammation, because it's basically tightened up and it's pulling that side of the pelvis forward and anterior, so it's causing a lot of inflammation. And so you'll see that, and you got to elongate that, and that can help to balance out that pelvis as well.